Hi, I'm Stephanie and I'm from Florida and I am a patient advocate living with CIDP. Being diagnosed with CIDP is very overwhelming. You know, most people have never heard of this disease before. I certainly had not. We were, on the internet right away trying to figure out anything that we could about it, which was really scary. But the more we learned, we realized there's treatments available. There is no cure, but it's manageable, which gave us a lot of hope. I first heard about Hizentra from my nurse who would come to my house to do my IVIg every 3 weeks, and she used to work at my doctor's office. She was telling me that I would be a really good candidate for this. And I was very reluctant. I didn't look forward to even learning how to do it or anything, but every 3 weeks she would come in, she would bring it up over and over again, and eventually she was explaining to me how it would be better for me. She was showing me in my Ig levels what was happening during IVIg and what would be happening if I would try Hizentra. So I was always told by the nurses that I was a tough stick, or I had bad veins, and so they thought that Hizentra would be a good option for me. All the troubles that I had getting the IVs in, sometimes it'd be 4 or 5 sticks till we got one that would work. I just didn't think I was qualified for the job, because I thought, if these medical professionals, are having a tough enough time, how am I gonna be any better? It was pretty scary the first time, but the nurses did everything for me. So, I just watched and learned. The next week I went in and I did everything myself with their supervision to make sure I was doing everything properly, which I did. And then I was free to go on forward at that point at home. Whenever I would get my IVIg, I would feel pretty good for about 2 weeks. So I was starting from a good place, and I did the Hizentra, and then I felt exactly the same. And then another week, I did Hizentra and I felt exactly the same. And so then now here comes the 3rd week, normally where I'm gonna be running out of juice, if you will. And I pretty much just stayed the same. So another week, I just kept feeling the same, which, so it took me about a month or 2 where I was like, wow, this is really exactly what my nurse told me it was gonna be like, just slow and steady, no more giant dips, up and down, up and down. And I mean, it was very exciting. I was thrilled, actually. When I was doing IVIg, that would entail me making an appointment, obviously, for my nurse to come over. We considered it an all-day event. It would be about 6 or 7 hours. The rest of that day, you're not gonna do anything. You're gonna be watching a movie on the couch, basically. And then the next day, about the same, really. And then, a couple days later, you're getting your energy back. You're ready to go, which holds on for, a couple weeks. And then it starts depleting again. And then you know when it's time. You don't have to look at the calendar. You know when it's time for your IVIg. So when I switched to Hizentra, instead of my roller coaster of Ig levels, it just kind of stayed in the same. So it's been over 6 years, and I really feel the same every day. I don't ever notice a dip. So I do love that. I can count on it. I don't have to schedule, oh, this is gonna be the week where you're not gonna wanna do this or that. I can just go about my business. When I was on IVIg, I used to get pretty severe side effects. My very first dose of IVIg, I had probably 104-degree fever. I could barely lift my head off of the pillow. My headache was so severe. And that continued for a couple of days. When I started Hizentra, my first side effects was just local reaction. I had a lot of itching, redness. That lasted for probably, not nonstop, but each time, probably the first month, and then that went away. I don't really ever have any site reactions anymore. I do occasionally get side effects. They're very mild. It's a little headache, maybe a fever. I just take some over-the-counter medicine and I go about my day. When I was first diagnosed, I had very limited physical activities. I was using a walker. I wore AFOs, which I still wear, actually. But I really struggled to get around. I mean, I was probably walking 1,000 steps a day. It was very little. I mean, I thought my IVIg was working for me, and it was. I was definitely getting better. It was just at a very slow pace. And when I got on Hizentra, it just like stabilized me in a way so that I could kind of push myself a little bit more, build up my strength. The more strong I got, the more I could do. Now I'm able to bike on my three-wheeler bike for miles and miles. I started playing golf again about 2 years ago, which I never thought I was going to be able to hang on to a golf club without flinging it into the fairway. So that's been like a real pleasure. My husband and I are playing golf quite a bit now. And I have two beautiful grandchildren that I can run around with and pick up and play with, which is a blessing. I always tell people to just give it a try. I mean, honestly, when I look back on the 6 months that I refused to try it, and I regret it.
Important safety information. Warning. Thrombosis, blood clots, can occur with immune globulin products, including Hizentra. Risk factors can include advanced age, prolonged immobilization, a history of blood clotting or hyperviscosity, blood thickness, use of estrogens, installed vascular catheters, and cardiovascular risk factors. If you are at high risk of blood clots, your doctor will prescribe Hizentra at the minimum dose and infusion rate practicable and will monitor for signs of clotting events and hyperviscosity. Always drink sufficient fluids before infusing Hizentra. See your doctor for a full explanation and the full prescribing information for complete boxed warning. Hizentra, immune globulin subcutaneous, human, 20% liquid, is a prescription medicine used to treat primary immune deficiency, PI, in patients 2 years and older, and chronic inflammatory demyelinating polyneuropathy, CIDP, in adults. Treatment with Hizentra might not be possible if your doctor determines you have hyperprolinemia, too much proline in the blood, or are IgA deficient with antibodies to IgA and a history of hypersensitivity. Tell your doctor if you have previously had a severe allergic reaction, including anaphylaxis, to the administration of human immune globulin. Tell your doctor right away, or go to the emergency room if you have hives, trouble breathing, wheezing, dizziness, or fainting. These could be signs of a bad allergic reaction. Inform your doctor of any medications you are taking, as well as any medical conditions you may have had, especially if you have a history of diseases related to the heart or blood vessels, or have been immobile for some time. Inform your physician if you are pregnant or nursing or plan to become pregnant. Infuse Hizentra under your skin only. Do not inject into a blood vessel. Self-administer Hizentra only after having been taught to do so by your doctor or other healthcare professional and having received dosing instructions for treating your condition. Immediately report to your physician any of the following symptoms, which could be signs of serious adverse reactions to Hizentra: reduced urination, sudden weight gain, or swelling in your legs, possible signs of a kidney problem, pain and/or swelling or discoloration of an arm or leg, unexplained shortness of breath, chest pain or discomfort that worsens on deep breathing, unexplained rapid pulse, or numbness or weakness on one side of the body, possible signs of a blood clot, bad headache with nausea, vomiting, stiff neck, fever, and sensitivity to light, possible signs of meningitis, brown or red urine, rapid heart rate, yellowing of the skin or eyes, chest pains or breathing trouble, fever over 100 degrees Fahrenheit, possible symptoms of other conditions that require prompt treatment. Hizentra is made from human blood. The risk of transmission of infectious agents, including viruses and, theoretically, the Creutzfeldt-Jakob disease, CJD agent, and its variant, VCJD, cannot be completely eliminated. The most common side effects in the clinical trials for Hizentra include redness, swelling, itching and/or bruising at the infusion site, headache, chest, joint, or back pain, diarrhea, tiredness, cough, rash, itching, fever, nausea, and vomiting. These are not the only side effects possible. Tell your doctor about any side effect that bothers you or does not go away. Before receiving any vaccine, tell immunizing physician if you have had recent therapy with Hizentra, as effectiveness of the vaccine could be compromised. Please see full prescribing information for Hizentra, including boxed warning and the patient product information. You are encouraged to report negative side effects of prescription drugs to the FDA. Visit www.fda.gov/medwatch or call 1-800-FDA-1088. You can also report side effects to CSL Behring's Pharmacovigilance Department at 1-866-915-6958.